Kidney stones affect many people of all ages. And then this week, CHI St. Vincent Your Health Report, we take a look at a new study that reports patients with kidney stones may be at increased risk of bone fractures.
Kidney stones actually affect a lot more people than I think most physicians and even the public recognizes.
Dr. Morgan Sauer is a geriatric specialist at CHI St. Vincent. He knows about the prevalence of kidney stones, having had them himself.
When I had my kidney stone, it was a shock. I'd never had anything like this happen to me before. And it started off that I just had to go to the bathroom every 2 minutes and felt the urge and felt nauseated. Something was wrong.
Dr. Sauer says the early symptoms were followed by waves of pain commonly associated with kidney stones.
As the pain gets worse, you start to develop other symptoms like urinating blood, vomiting, and can lead to diarrhea.
He says since the kidneys help balance the body's calcium levels, when that pathway becomes abnormal, it can put patients at risk for kidney stones made from calcium and at an increased risk for bone fracture.
Whenever the body is calling on the bones to release calcium in order to try and use it for cardiac function, nerve function, and muscle function, any calcium that comes out of the bones makes the bones weaker. So you would have an increased risk for fracture if your body keeps taking calcium out of the bones.
Dr. Sauer says water intake is an important part of preventing kidney stones.
People have kidney stones. It's important to increase your water intake. I went from drinking 5 Diet Cokes a day to having no soda pops, and in fact, I don't drink caffeine anymore.
And Dr. Sauer says kidney stones are typically an emergency, so you should either get in to see your primary care physician or urologist right away or head to the emergency room.
Well,